for you. Africa, Africa, Africa. Mama T wait for you. Africa, Africa, Africa. With her eyes wide.
Welcome everybody, welcome to the Celebrate Africa TV show. This is the first edition, the Celebrate Africa TV show. It's a TV show that celebrates Africa and Africans making a difference in their communities. Today on the show, we're going to be talking to some very talented, inspiring Africans from different African countries who are making huge and tremendous differences in their communities. They're putting smiles on people's faces, they're transforming lives, and they hope to do so much more.
Africa, Africa, Africa. Mama T wait for you.
Welcome back, ladies and gentlemen. If you're just joining us, you on the Celebrate Africa TV show. We're just so excited to have you. On this show, we talk to Africans, amazing Africans, outstanding Africans, those ones that are doing things that impact the communities and change lives. Right now, we're going to be talking to this amazing woman. She comes from two great African nations, Uganda and Tanzania. But today on the program, she will be telling us about some of her works. She focuses on working with newborns, adolescents, and especially mothers. Let's meet her right now, and she's Tausi Suedi. How are you?
I'm well. How are you?
I am excellent. Thank you so much for accepting to be part of us today.
It's a blessing to be here.
Tell me a little bit about you.
Tausi. Tausi is a Swahili name. It means the peacock, the beautiful bird. That's what Tausi means. And I am the co-founder and the CEO of Childbirth Survival International, an international nonprofit based in Baltimore, Maryland, that focuses on reaching the unreached with health services and information. Our work focuses on helping mothers survive pregnancy and childbirth. As you might know, in many African countries and also some parts of Asia, women die giving birth for reasons that are very preventable. So the work that we do, we save lives, essentially. We work with midwives to make sure that they're providing quality services to these pregnant women. We work with adolescents, especially the girl child, to make sure that she goes to school, she stays in school, and she goes post-secondary and avoid teenage pregnancies, HIV, and all these other burdens that tend to affect adolescent girls when they're still young.
Wow, this must certainly be a very tedious, venture for you to be involved in that, especially given the health infrastructures that we have in Africa. How do you manage that?
We go in knowing that these communities are underserved. They don't have the strong healthcare systems or infrastructure that is desirable or that will be ideal in order to push some of these efforts forward. So what we do is we work with what's there. So we go to a health facility, and however it is structured at that time, we figure out where are the gaps and we try to address those gaps. One of the major gaps that we have seen in health facilities has been lack of medical supplies. So basic medical supplies, things like gloves and cotton and placenta bags, things that are very basic that should be in health facilities are often lacking. And then families have to buy these medical supplies. And these are families that are already poor. A lot of them living on less than $2 a day, they cannot afford to buy medical supplies that are worth $10 or $20. So the work that CSI has been doing to date, over 300 women have benefited from the program called Saving Lives at Birth. And we purchased these childbirth kits from a company based out in Chicago, and we ship them out to where they're needed. So far, we've done this in Tanzania and Uganda, and we give them to the pregnant women. And that also empowers them to go to live in a hospital. And then we train the nurses and midwives on the contents of these childbirth kits. So they understand how to use them, and they're able to provide the services and help mothers survive.
How do you make sure that the right people get access to these kits?
Childbirth Survival International has a mantra, and that is reaching the unreached. And when we say reaching the unreached, we are reaching the unreached. So the example that I gave you of the pregnant women, they are getting these childbirth kits. Unlike giving them to the hospital, to the government, to the nurses and midwives, for the women to go and then be charged for what we have given for free essentially doesn't fit the purpose. So we give them to the pregnant women, and then that empowers them. So that has reached them. We provide adolescent girls with sanitary pads so they can go to school and stay in school and engage in extracurricular activities. And through that, we are giving them to the girls and not the school or their parents or their guardians. And so when you talk about transparency and accountability,
Yeah.
and of course in these settings where there are a lot of challenges politically, it's understandable. And we as an organization recognize that, and we make sure that we are actually reaching the unreached. We are giving, we are delivering the services that need to be delivered to the right people.
What's the structure that
That we have on the ground teams.
Okay.
We believe in empowering people.
Okay.
There are people in Africa, educated, talented, resourceful, and so we recruit, people from within the communities who are passionate about the cause, who also believe in the cause of CSI, and they become the champions in terms of the interventions that we're implementing on the ground, saving lives at birth, training nurses and midwives, reaching out to youth, keeping them healthy, alive, and informed, especially where you have high rates of HIV and AIDS going around, helping the girl child go to school, and we work a lot with communities.
For you to do something like this, it must have come from a place of passion. Is there a particular story attached to this? Is there an experience that you had that pushed you to start working towards this?
So you're asking me $1 million question, and I guess
It
I'll
is
answer
$1 million
it.
question, because the passion with which you talk about this, that's what made me ask you this question.
Right.
Because
So growing up as a little girl, I wanted to be an obstetrician,
okay,
a gynecologist. And through our international travels when we're young, I never quite understood when we would travel from certain parts of the world and then would go to, let's say, Tanzania and Uganda to visit family. And you see kids without shoes. You go to hospitals and people on the floor, and it never quite clicked. And as I grew older, I got to understand the inequalities and the inequities in different societies. And I ended up veering off the medical to the public health side, realizing that more work needed to be done in the public health space. It's easy to deliver a woman. It's very easy to help her, pretty much deliver her baby. But then what about the steps that lead to that delivery? The healthy pregnancy, the informed pregnancy, the spouse that's supportive, the girl child that knows, she shouldn't be having sex, period. She should know what menstruation is. She should go to, so there are a lot of challenges on the back end before people actually get to the hospital. And that's where kind of, I don't want to say changed, it just shifted. So I didn't want to be the medical doctor delivering babies, but I wanted to be out on the field, like be the public health doctor per se.
how has that experience been so far? It's been 12 years. Is it 12 or more?
More. It's
More
been
than 12
it's been
years.
amazing. It's been amazing. The women that you're able to serve, the women that you're able to impact, the numerous thank yous that come, people asking you, what's your name? And you're like, it doesn't matter. It's okay, as
It's
long as you have
okay.
survived the pregnancy.
Now, do you get funding at all, or do you have like some, sponsors who kind of like push the work forward?
We have, kind of stretched out differently, but most of our funding comes through generous donors, through the Diaspora. We have online campaigns. So for example, we have a campaign that's ongoing right now to raise $7,000 to procure 1,000 childbirth kits. Each kit costs $7, which is, I think, a cup of coffee at Starbucks. I don't drink coffee, but someone can tell me. Each kit costs $7, and that kit contains everything a woman needs to go and deliver.
Wow.
And so if we're able to get these for 1,000 women and be able to distribute them and help mothers and their families, that will be a huge bonus.
And we certainly hope that Africa and the world is watching right now, and they are getting ready to support this very, very, very unique cause, which is changing lives. Well, we are ready to spread the word. We're ready to take up the mantle and join this fight, because we want many more, newborns to survive, many more adolescents to be healthy, and especially mothers who are giving birth to be able to live, to survive.
Absolutely.
So thank you so much.
Thank you.